Hi everybody, my name's Lauren and I did Crohn's disease. So what is Crohn's exactly? Crohn's is a chronic inflammatory disease in the digestive system that can affect anywhere from the mouth to the anus. Many times there are lesions on the tissues which causes the pain. The lining of the tissues is what has the lesions. It's depending on what you eat can make the lesions bigger and start to even bleed. And many of the times, the lesions are found in the esophagus, duodenum, and the intestinal tract. But the most common place is the ileocecal region, which is that ending of the small intestine and emptying into the large intestine. And this can cause a massive amount of problems for a healthy individual. So it can change their entire life. Some signs and symptoms are chronic diarrhea, and to be chronic, it has to be for at least 4 weeks of chronic diarrhea. So if you go to a doctor and say, I've been having diarrhea for the past 3 days and my stomach hurts and I have a fever, they're not really going to look at Crohn's yet because you haven't had that diarrhea for at least 4 weeks. Another one is fever, blood in the stool from the blood from the lesions with the food. Gastric pain is right on your stomach pain. Appetite and weight loss because you're afraid to eat something, so you lose weight. An MRE and endoscopy are the best ways to diagnose Crohn's. So an MRE is done before any endoscopy to see if there needs one to be done. In doing the MRE, it's the patient would ingest a dye, so they would drink like a radioactive dye, and that would light up on the MRI machine. So it would see everything from the mouth to the esophagus, all the way down through the stomach into the intestines, and obviously out. This would help the gastroenterologist and radiologist justify why they need to do the endoscopy, because they can see the fistulas or the lesions on the intestinal tract during the MRE. Because that is the best way to get diagnosed, is the endoscopy, because you're seeing the clear images of what is actually going on inside the intestines when there's no food in there. So that makes the diagnosis more accurate. After the diagnosis, so because there is no treatment option for Crohn's, it's all managing, and how you manage it is the most important factor. So after the diagnosis, there is possible surgery, but it's not really common. That's for more progressed Crohn's, if it's really severe and there are fistulas that are just deteriorating a part of the intestine. They will take that part of the intestine out and put a colostomy bag in. Exercising will overall help reduce swelling in your digestive tract, and your diet will really help with the management of how your life quality is. And again, it's all management of the disease. There is no treatment. Exercise, again, is one of the best things to manage Crohn's, because there is no inflammation, because it helps reduce that inflammation of the digestive tract. One of the studies that I looked at was a HIIT training, so the high intensity interval training, and moderate intensity training are the ones that were more studied. They were the most beneficial. It wasn't more so of the reducing the inflammation, but a lot of it was helping the overall quality of life and how they felt better because they were working out so much. Diet, you really want to be careful of what foods you're eating, because everything you put into your body is what your body is going to react to. So avoiding foods that are raw, so like raw cookie dough, anything that's really high in fat content. So a lot of avocados, cheese are really high fat in content, and a lot of people have problems with that. Another thing you should really avoid is eating fried foods, because your body it's so hard to digest those foods that it really takes a toll on the lining of the intestines and the digestive tract. And making sure you're eating a lot of fruits and vegetables, because there's a lot of water in like celery and watermelon, grapes, all of those that can really get those nutrients inside of you. As ATs, what should we do? We need to monitor during practices and games, talking to the athlete, making sure they're okay, and making sure they're able to eat on away trips. So when we go away, making sure, okay, we're not stopping at McDonald's every time or something like that. And you have the final decision on whether the athlete is participating. If they come to you and say, I can't do it today, like I'm having a really bad day with my disease, and the coach says, oh, she's faking it, you have that final decision with talking to both the athlete and the coach. And there are my references. Thank you.